Rise. Good morning, Commissioner Arner. If you may lead us in a prayer and pledge.
Father, thank you for the men and women who protect us from the recent fires. Give them peace when their dedication to save lives take them away from their families. We also pray specifically for their wives, husbands, and children. We ask that you draw near to them and give them the wisdom on how to support one another while apart. Rest in God as the day unfolds. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
One note I would like to make is before the commissioners' reports at the end of the meeting, we will be presenting a proclamation to Trinity Food Pantry, Lutheran Food Pantry in Lee Heighton. So we'll be handling that at that time. Okay,
The motion.
You're making a motion.
I'll make that motion.
I'll second.
Mr. Arner,
Yes.
Mr. Sifranco.
Yes, thank you.
These proceedings are being recorded for the sole purpose of preparing accurate written minutes. Recordings are overwritten following approval of the minutes, eliminating all unofficial records of these proceedings. Your first item is the approval of the minutes at the meeting held April 17th, 2025.
Motion approved.
Second,
Mr. Arner,
Yes.
Mr. Sifranco.
yes. Are there any guests here concerning county business? Can we stand and state your name?
I just wanted to say that my husband Roy and I are here to applaud the work of Trinity Food Bank. Unfortunately, we won't be able to stay till the end of the meeting, so we want to congratulate them at this point.
Thank you. Thank you. Anyone else? Any further? Hearing none? Continue.
Next item is the proclamation number 25-185, Pop Out Day.
Motion adopted.
Second,
Mr. Arner,
Yes.
Mr. Sifranco.
yes. Robert, do you wish to, I think there's someone here to present to? Yes. So if you wish to read, you need to.
Whereas the youth of Carbon County is one of the county's most valuable resources, and whereas 1 out of every 5 children in the United States is obese or at risk of becoming obese, and whereas obesity is now proven to be a direct cause of health-related diseases and costs business and industry millions of dollars each year. And whereas data has proven that there is a direct relationship between increased soft drink consumption, inactivity, and overweight children. And whereas it is further understood that high sugar beverages provide limited nutritional value and should be consumed on a limited basis as per the My Plate Healthy Eating Chart. And whereas there are other beverages available that offer nutritional advantages such as water, 100% fruit juices, and milk. Now, therefore, the Carbon County Board of Commissioners does hereby proclaim May 14, 2025 as Pop Out Day in Carbon County and urges all children, their parents, and the citizens of Carbon County to restrain or restrict their consumption of empty calories, as in soft drinks, iced tea, and sports drinks. Adopted by the Carbon County Board of Commissioners this first day of May 2025.
Okay, I've been doing this for many, many years. I was the 4-H educator in the county, and part of our job responsibility was to go out to the community, you know, and serve on other committees. And when the school districts were required to have wellness councils, that was one of my areas I enjoyed doing. Weatherly is probably one of the few schools that do continue. Becky McFadden is our school nurse, and we continue, we meet on a monthly basis and stuff like that. So May 14th, we hand out, we're in the lunchroom with the kids, they get a little bottle of water, just to promote the idea of drinking water is better overall than anything. The sugary drinks and stuff like that. Powerades and sports drinks are fine if you're an active child or, to replace the nutrients and electrolytes in your body. But, water is probably one of the better things that any person can, intake into their bodies. And a lot of us probably now are actually feeling like our mouths are a little dry, our bodies are actually starting to go into like a dehydration mode, and especially even for our internal organs, it's a good idea. Water is one of the best things that you can do. Okay,
Thank you.
thank you.
Thanks for all your hard work.
Thank you.
Thank you, Dorothy. Okay, our next item number 25-186 is the opening of bids via Pennbid for food service at the Carbon County Correctional Facility.
We had two, the first one being Aramark, $1,548,220.50. The second one from Trinity Services Group for $1,486,134.
I'll make a motion to table for 2 months, or 2 weeks. I mean, not 2 months. 2 weeks.
You're on the roll today, aren't you? I will second that motion.
Mr. Honor,
Yes,
Mr. Sifranco.
Yes.
The next item is an opening of bids for the Carbon County Whole Home Repair Program. Plumbing contract number BP 659-137. And I didn't bring a letter opener. I won't be able to get in it anyway.
and,
Let's try it. But. He's got a corner now. Thank you, Jess. Let's start.
Let me ask Bob. You don't need a motion.
we can move it up.
Move it up
Okay.
when we get after correspondence.
And the
Yeah,
bidder is Northeast Construction Management Group of Lehigh, Pennsylvania. The amount bid is $11,747.
And there is a bond for 10%.
That's all the bids.
Yeah, motion. What do we do?
2 weeks, 2 weeks for review.
Mike, did you second?
Yes, second.
We're
Mr.
just
Barnes?
thinking about something else.
Okay.
Yes.
Mr. Barnes, Mr. Sifranco.
Yes,
Next item is the report of executive sessions held.
there were none.
Department reports. Item number 25-188, the budget transfers.
Motion approved.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-189, the supplemental appropriations.
Motion approved.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-190, expenditures, payroll.
Motion ratify.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-191,
Motion ratify.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-192,
Motion ratify.
Second?
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Number 25-193.
Motion approved.
Second?
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Number 25-194, treasurer's reports.
Motion approved, both as presented.
Second?
Mr. Honor?
Yes.
Mr. Sifranco?
Yes. We'll now recess Commissioners Board for the Salary Board. Are there any guests here concerning Salary Board business? Hearing none?
Your first item is the approval of the minutes of salary board meetings held April 3rd and reconvened on April 17th.
Motion approved.
Second?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Report of executive sessions held.
There was one held on April 29th at 2025 in 2025, and it was at 1:30 PM, obviously to discuss personnel reasons.
The public defender, Attorney Wiltrout?
Yes. Make a motion to abolish position of one full-time assistant public defender. Has to be reached union prevailing rate effective May 1st, 2025.
Second.
Attorney Wiltrout?
And
Attorney Wilder, we'll
Yes
we'll
or
need you
no?
to, yes, sir. You're okay.
Yes.
Mr. Honor? Mr. Sifranco?
Yes.
prevailing rate
Second.
Attorney Wiltrout? Mrs. Furman?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Children and Youth Services. Change the rate of two county caseworker one from $20.49 per hour, grade 9, step B, to $19.99 per hour, grade 9, step A, effective May 1, 2025.
Motion to change the rate.
Second.
Mrs. Harmon?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Corrections, change the rate of one part-time corrections officer from $16.85 per hour, grade 5, step B, to $16.44 per hour, grade 5, step A, effective May 1, 2025.
Motion to change the rate.
Second.
Mrs. Harmon?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Emergency Management, change the rate of one EMA coordinator from $25.23 per hour, grade S7, step F, to $27.85 per hour, grade S7, step J, effective May 12th, 2025.
Motion to change the rate.
Second.
Mrs. Harmon?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Establish the position of one administrative assistant, one trainee, at $19.03 per hour, grade 8, step A, effective May 1, 2025.
Motion to establish the position.
Second.
Mrs. Harmon?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Parking, change the rate of one part-time parking meter attendant from $14.56 per hour, grade 2, step B, to $14.20 per hour, grade 4, step A, effective May 1, 2025.
Motion to change the rate.
Second.
Mrs. Herman?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Tax claim, change the rate of one assistant director from $22.33 per hour, grade S5, step E, to $22.89 per hour, grade S5, step F, effective May 12th, 2025.
Motion to change the rate.
Second.
Mrs. Herman?
Yes.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes. Any further? With that, we will reconvene the commissioners meeting, adjourn the salary board. As I'm getting looked at.
Okay, your next item, number 25-195, the personnel report for county departments.
So move.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Number 25-196, the acknowledgements for courts and row offices.
So move.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Correspondence was received as listed. Copies will be made available to the press upon request.
Go ahead. Before you advertise, I just would like to make one adjustment here to the agenda. It's item number 25-219 in reference to the correctional facility and MAT program. We do have our district attorney and our sheriff with us, and our district attorney serves as the president of the or chairman, I should say, of the prison board. So at the request of Commissioner Arner, he had asked that we move this up at the beginning of this so we can handle that. I know you gentlemen may have some other places to be, and this will come up.
Can we have a motion to amend?
I'm gonna make motion of amend.
I'll second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes. So we can just handle that right and then proceed.
That's under the solicitor's report,
Yeah.
so,
That's the
So-
25-219.
the motion for item 25-219 under the correctional facility is to limit the medication-assisted treatment program at the correctional facility to injectable Vivitrol to eligible inmates.
And it's gonna be amended to injectables, not just specific to Vivitrol.
So that would be to injectable qualified
Yes,
MAT
yes.
medications.
Yes. And I'm making that motion with some discussion.
And I will second and allow Commissioner Arner and
I guess, we've been debating on this, on what we're supposed to give the inmates for rehabilitation through the MAT program, at our correctional facility. And there have been issues, and I can't really say it's specific to our county, but, the less we use pills within the facility, the better off we are. With the injectables, they're claiming that, I mean, even with Prime Care, our provider, that it costs more money. And I beg to differ on that because, an injectable could cost maybe $1,000, which would take you the whole month. And, people that are on a pill that when we release them, we don't know if they're gonna take the pills, if they're gonna sell them. So with the injectable, if we release them with that and put them on a program, that they have 3 months supply, and that would be through either Medicaid or, however it would be done through the prison on their, home plan. But I think I don't know if the DA wants to comment or the sheriff, but I have some like statistics here. Now, what I'd like to do is we have the Vivitrol grant. That I think is $114,000. We also have opiate money that we get matched at. So the Vivitrol grant is used for opiate and alcohol. So each county is not the same. If you go to Wayne County, if you go to Monroe County, they might be drug users, and Carbon County could be alcohol. So what we're trying to do is get people out the door and on the right path to having a successful life. And I know there's been some lawsuits that are coming up through different things, but I don't see how there could be a lawsuit on us trying to help people. But and just on savings to the county, there's all kinds of statistics out there, but the people realize when somebody comes back into the facility, we all talk about recidivism to try to keep them out, but when they come back, it's $140 a day to have an inmate. So that's for 3 months. We have to take care of their medical, which we don't know what it is. We have transportation to hospitals. They could be on dialysis. They could get operations. I mean, one inmate could wind up being $100,000. And, and I think the thing about it, like, Prime Care was always stressing on it that, We're gonna get in a lawsuit, and I think it's our choice what we want. And I have it highlighted in red. This is being done solely on the safety and security issues at our prison. And we don't want any issues. So I don't know if the district attorney, if he'd like to make a couple comments on, you know, what is, this is gonna help us by doing the injectables.
This came up at our prison board meeting, and when we became alerted to it,
Yes.
that there's a bit of a problem when you're dealing with, the prescription medication, not injectables. The ability for inmates to, cheek it or conceal it or dispose of it or dispense it, transfer it around. That's inevitable with any type of medication, but now you're dealing with an MET program with which medications give a similar result to an opioid, which makes it more desirable for the prison population. And I don't think we had, when we started the MAT program, though we had the grant, and what we envisioned is not what was taking place in the prison. And it creates a definite burden, personnel wise,
Well, yeah,
for our guard staff to consistently watch, make sure these things are ingested rather than, and where you have an injectable, it's just done, it's provided to them. There's no way that they are able to use that throughout the prison. And our office was involved in incidents at the prison, and it gives rise to other criminal activity within there.
correct.
This may curtail that, and I think it's safer just to have it all around. We discussed it at the prison board meeting, and it was our recommendation, and I agree with Commissioner Warner, that anything that's dispensed that way in the nature of a medically assisted treatment should be by an injection. You should not, shouldn't have to take up the staff, and there needs to be a protocol, which was never established when it went in, and it shouldn't be purely within the inmate selection of what they perceive that they want. It's a correctional facility. It should be medically. This is what you have. This is what your use was. This is what we're prescribing. Or we're moving it to a situation where we have everybody at the prison wanting,
Yeah.
anybody that's
Oh,
there
yeah.
would want it because they. I think it really needs to be monitored a lot more than when it went right in.
And the injectables are proven that they work.
They
You know,
do work. They're an
yeah.
antagonistic.
Yeah.
They stop the cravings or the ability to want to take it,
Yeah.
as opposed to a weaning off. And even in any of the things that we have, we provide it, but there's not even, the tapering off. I didn't see, I seen it in a protocol, but I didn't get to go through it as much as I'd like to. But you need to taper off. It's designed to have people off of this, not continue it on. And that's, and prior to this, you didn't have any.
No, we went from nothing to,
Yeah,
Dispensing
to now everybody has it. Yeah.
yeah. And I mean, one of the things that bothered me a lot was that we had somebody that could have been in prison for 6 months, and they have 6 months left on their term, and we're getting a pill, which that's not right. The MAT program was to get them out the door and get them onto a successful life. That's what the
It's
program
tough to
is.
balance the philosophies
Yeah,
of
I
an
know.
MA
Yeah.
treatment
Yeah,
and what's
yeah.
best for any type of addiction or things like that, just like the MET treatment, follows medical marijuana. Yet there's no prescription. There's no percentage of THC. You get a medical marijuana card and you have the entire use. And that could, that's not part of it, but can an argument be made that should be allowed at the prison too? I mean, what road would
Yeah,
you
I
go
know.
down with this?
Yeah,
You can stick with the injectables. That's our use the recommendation from me as the district attorney.
right.
And I can't speak on behalf of the prison board because we had to take a vote, but that's what I gleaned out of our.
And,
prison board
and
meetings.
even back to the guards, I mean, you take a guard that has to watch 30 inmates for 20 minutes, that comes up to 10 hours a day. That's not just one guard, that's 2 guards because they're taking breaks. So you're taking them away from their duties. I mean, we have to worry about watching people, on suicide watch and the whole 9 yards. And here there's an injectable, you could probably have it done once a month. And it would probably take 2 hours to give the same amount of people the medication. But they have to sit there every day to administrate this to the inmates. It's like,
Watch them to make sure that they eat crackers,
Yeah,
drink
yeah,
water,
yeah.
just constantly watch them to make
Yeah.
sure that it's not. concealed
and that
substance.
does not warrant that they're not gonna cheek it. They
Still
can,
do it.
they can still.
Well, it was done.
Yeah. So I think that's the way to go, but I think after this we'll have to, and there are some some maybe medical reasons that somebody might not be able to take it. We're not denying them of that. But this here, and like I said, if this is proven and, you know, the FDA says this is proven after 3 months that you're on a program and injectable, it works, why wouldn't you want to do that? You know,
And I think there's other exceptions that if somebody's already on that type of treatment and they come in,
yeah.
you have to maintain that.
Yeah.
This is not a situation where you're trying to.
And
deny,
I,
But it should
yeah.
be a move toward
Yeah.
the injectable.
Yeah.
It should be, it
Well,
should be to, while you're in the
exactly.
prison, you shouldn't have
No.
anything in your.
If you're out and you're coming back in,
Yep.
maybe the program you're on isn't working. Maybe you
Right.
got to try something different. And the injectables, the second time around might be your route to go. And I think we want to help people. We want to make people have a good life. You know, it's not that we're denying anybody of anything.
And I think as long as the solicitor reviews it, but I think you're complying, you're offering an MAT, you're putting it in with enough, that there's enough safeguards in place and you have the reasons justifying why you want it that way. I don't think you have to start an MAT program that gives just, you know, cornucopia of a buffet line of every type of medication that's provided.
Yep.
I
Yeah.
think it's acceptable.
Yeah, we'll discuss it this afternoon.
Yeah, and I know the sheriff is here. I don't know if he wants to make a comment on it. It is taxing to your,
Yeah, I think that when you do a program like this, you have to keep the goal in mind. And using the injectables allows us to do that because we don't just want to treat them while they're in. You want to give them the best chance for success when they're discharged. So having to take a pill every day in or outside the facility is hard to maintain that. If you're getting an injectable that lasts 30 days potentially, their level of success and being able to be rehabilitated in the community is really what our goal is. And I think adopting this program with the injectables does that. I didn't get a chance to read the whole policy because it came out at the end of the
Yeah,
day
it's-
yesterday.
Mhm.
You know, but I'm confident that with your review, Commissioner, the solicitor, the district attorney's support of this, this is absolutely the way to go. So we don't have these folks continuing to have increased recidivism rates come back in and we're doing this all over again. So
we,
in my opinion, this is definitely the way to go and gives our people that need this treatment the best chance for success in the community.
thank you.
It will still take some revisions. I have
Yeah,
looked
we-
at it and it's going to need some revisions to meet those goals. But basically, we want these people to get clean. If they're clean and sober coming out, they're less likely to reoffend. But it's also not a Whitman sample where you get to decide whether you want the pills or the injectables.
Yeah.
I mean, if there's a medical reason for it to be a sublingual or other oral, but all you need is just a few moments. Somebody's looking away and they can divert that pill and give it to someone else. And that's what we want to prevent here by making it primarily injectables unless there's a medically necessary reason for another form.
And we had talked about these injections probably a year and a half ago, more than a year and a half. And it was the route to go because it was safe and it does help people. So like I said, if somebody wants to sue us, I don't know how you can sue us for trying to help you. Thank you.
I mean, the only thing I say before you call a vote is, and Commissioner Arner hit the head there, it was talked about for many years. And but by the county not offering any type of MAT program, we had a much bigger liability than going this way. So that's why the program got up and running. The liability to the county, to the taxpayers, was far more by not even offering a MAT program. So by doing that now, as our solicitor has said, and district attorney, there are some growing pains, and we're going to experience them and work through them. So I think that's the main goal here, is that the program's there, and like anything, when you first do, a lead up or a lift off, it takes some time to fit it into that. Not everything can be pigeonholed as we'd like to. So,
And this
with that-
program will be not any cost to the taxpayer.
Correct.
I mean, we're using the opiate money and the grant for Vivitrol.
and that's, what we're doing.
Yeah, not very often you get to do a program that doesn't cost anything.
May I pull the board?
Yes, you may.
Mr. Arner,
Yes.
Mr. Sifraco,
Yes. There you go. He's on a roll today.
Thanks, Mike. Dan.
Okay, getting back to the regular agenda, advertising. Number 25-197, the Carbon County Industrial Development Authority.
Motion approved.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Children and Youth Agreements, number 25-198.
Motion to approve and execute.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Communications, 911, item number 25-199.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-200, the Community Traffic Safety Project modification.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-201, the County Buildings and Grounds Rooftop Units, Johnson Controls.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-202, quotes for cameras.
I would like to table this till the next meeting.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-203, the P-Core Loss Prevention Grant.
I'd like to table that one as well.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Item number 25-204, the Correctional Facility, Johnson Controls.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-205, Department of Corrections, the PRIA Hotline Agreement.
Motion to approve and execute.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-206, PRIA Audit, a proposal.
Motion to approve and execute.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-207, an agreement with Pentella Data.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-208, Drug and Alcohol Commission, Amendment number 1 to their drug and alcohol program with the state.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Human Services, item number 25-209, the second quarter TFAB report.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Number 25-210, Multimodal Grant Program, Bridge number 19.
Motion to ratify.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-211, opioid settlement funds, Family Promise.
So move.
Second.
Just like to make a comment on that, so everyone's aware. We're using some we're gonna be using opioid settlement money to Family Promise, and this is to try to help those who are homeless and affected from opioids that has put them in the situations they're in. The action item speaks for itself. There was a request made to the county. We've honored most of that request, but not all. The county does have a checks and balance with this request. They will be providing us quarterly updates and reports as to the progress they are making with the homeless and this situation we have in the county. We did find a way to do this. We found that obviously we do have some homeless. We have in the county, and this is a way to reach out and help address that issue. But we will get monthly reports, quarterly reports to address this, and we hope to continue to work with that. It's one way that we did find a way to help that out through the opioid settlement money.
The board, Mr. Honor?
Yes.
Mr. Sifranco?
Yes,
Item number 25-212, Planning and Development Cooperation Agreement, Banks Township.
Motion to approve and execute.
second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-213, the Hazard Mitigation Plan Update.
So move,
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
Item number 25-214, Direct Spending Program, Senator Fetterman's Office for County Bridge 4.
Motion to ratify.
Second,
Mr. Honor?
Yes.
Mr. Sifranco?
yes.
The the solicitor's report.
Thank you. First, for the Area Agency on Aging, item 25-215, an agreement with Behavioral Health Associates.
So move.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Item 25-216, the charitable organization registration statement for the fiscal year ending June 30th, 2024.
So move.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Item 25-217, an agreement with Franklin Township Volunteer Fire Company.
Motion approved and execute.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
Item 25-218, a banner request from Renegades for the Jim Thorpe Area Running Festival.
So move.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
We already did item 25-219, so moving on to Mock Chunk Lake Park. Item 25-220, special activities agreement with Carbon County Kid Zone for Community Safety Day.
Motion approved and execute.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes.
And lastly, I guess it would be item 25-221 for a proclamation recognizing Trinity Evangelical Lutheran Church Pantry Appreciation Day.
You want me to read it? No. No, go ahead.
No, you got it. No, that's yours.
Okay, I'll briefly read it into the record. Whereas the Trinity Evangelical Lutheran Church Pantry of Lehighton, Pennsylvania has served our community with unwavering dedication and compassion for 55 years. And whereas the Trinity Evangelical Lutheran Church Pantry began as a ministry in 1970, initially operating from a humble space within the church library. And whereas through the exceptional generosity of parishioners, community partners, and government programs, the pantry expanded its operations in 1984 with the establishment of a county-wide food system, and thanks to additional space provided by the church in 1991 and 2001, has been able to efficiently serve its growing clientele. And whereas the Trinity Evangelical Lutheran Church Pantry continues to provide vital sustenance to over 400 families each month. And whereas the remarkable success of the Trinity Evangelical Lutheran Church Pantry is a testament to the tireless efforts and commitments of its volunteers, notably Eleanor Zern, the founder and longtime coordinator, and current coordinators Carolyn and the late Ronald Long. And whereas the Trinity Evangelical Lutheran Church Pantry's steadfast service embodies the spirit of compassion, community, shared responsibility, and is now a cornerstone of our community's support systems. Now, therefore, be it resolved, the Carbon County Board of Commissioners, in honor of the Trinity Evangelical Lutheran Church Pantry, and in continuing support for and with a true appreciation of the Trinity Pantry's role in society, hereby proclaims May 1st, 2025 as Trinity Evangelical Lutheran Church Pantry Appreciation Day in Carbon County, and directs that a copy of this resolution be delivered to the leaders or representatives of this fine organization. You need a motion.
You want to sign? Not often we get to sign the proclamation right before we hand it out, but
And I am bringing a strawberry cake to the next meeting, right?
No, they didn't.
we need a motion to adopt this. Yes.
Yep.
That's fine.
I don't know if it's stamped, please, or does
No.
does anybody have permission to sign his name?
No.
or stamp? Okay,
Yes.
yes, please. All right, before we hand it out, and even though we signed, sealed everything, we do need a motion to approve it. So I will make that motion.
Second.
Mr. Honor?
Yes.
Mr. Sifranco?
Yes. I am waiting for Commissioner Notstein's stamp for you, so if you don't mind.
Any comments from anyone? Carol?
Right now, it takes about 30 volunteers. But we love it.
No, and they do an excellent job. I mean, and if it wasn't for them, I mean, throughout the county, this wouldn't have happened without Trinity starting this. And, I think we serve over 1,000 families throughout the county in a month. So without your start, the whole county, would have been lacking. So thank you very much for what Trinity has done and for the workers that are there.
Pastor Spawn's all we need.
Oh, yeah. That's good. Yeah.
Recognize too, like a meal, like February or something like. But, I know the post 314 and also I post 360 in Leadway, we work with the veterans. And I know the need is there for food. It's bad, you know. And we have a fantastic food. We go out and get food and bring it in.
Right.
We have a couple that does, well, there's more than a couple most. They get bread at Johnny's on Tuesday, so everybody gets bread. We go to Walmart on Monday, and it's amazing, just amazing what food we get that would have been thrown in the garbage. Every Monday and get. So therefore, we make up what we call produce boxes. And they get whatever we have, you know, oranges, lettuce, and corn, you name it, and they get a box. And we also do what we call our frozen bag. They get a bag of frozen meat, at least 2, called mishmash, and sandwiches or whatever. And bag groceries, and then day one of the pandemic, I said, we need to do something for the kids. So we have a kids bag, and the kids get a bag of, we try to keep it nutritional, but sometimes, you know, we have cookies and, you know, kids need cookies.
Yeah, and I do. I need cookies.
Or people contact me, I can't be the one. Everybody jumps in and out, so.
And if you want to save money, you can get rid of your gym membership. Because the ladies, when I go down there, they push me to the side, they jump on my truck, get the food out, so you can save money. And, a little bit different on the subject. I don't know if everybody knows this. This is Caleb's grandmother. So.
Would you like to introduce the ladies that are here with you?
Yeah, get Caleb, yeah. Yeah, go get Caleb.
Yeah. Do you want to introduce the ladies who are here with you?
Then she's a. Yeah.
She's the one that had it right and I crossed the wires up. Yeah, okay.
The longest one working with the pantry. Shirley started in the early 90s, and I right behind her, because she said, oh, we need help on Tuesday. I said, okay. So I went and helped. They said, well, are you coming next Tuesday? And I started it, so I've been there every Tuesday, I think, set up. Come in. This is Carol O'Brien, Cindy McKay, and Sharon McCallsky. And they, again, we just jump in and do whatever's needed.
Okay, well, we're gonna hand this out.
Did you leave a note?
Is he over there?
Oh.
He won't come in.
Sure we got on the phone. You heard you walking down the hall.
No, he's on the phone.
Okay.
He's actually working.
I'm gonna go get it. I'm gonna go get it.
Okay. Well, thank you very much. Okay. Everybody could have came up.
Yeah.
Why don't you all come up and talk? Oh, come on. I'm always on the end, they always prop me out. So there'll be room in the front.
No, thank you. No, thank you.
No, I'll go in the back. I'll stand in front of you.
Signing the proclamation.
I don't play.
Oh, no, wait.
We're on a roll today, Commissioner.
Everybody?
Well, thank you all for everything you're doing. Now we're gonna go get your grandson. I'll be right back.
Someone up their computer's crashing.
You'll have no choice now.
So where are we at? Did we, no, we didn't even adjourn.
No, we didn't adjourn yet. We're in a lull.
Where the heck was I the other day when somebody left and I adjourned the meeting? Was that prison board or something? No, what the heck was it?
Yeah, we gotta get this on camera here. Photo here.
We've had a very good conversation with your grandmother and we're gonna have to talk afterward.
He was off in the corner on his blanket.
Oh, God. We won the picture.
Why you come up here and get a, why you do that? Can you do that for us, Amy? Here you go. We'll get you a picture so the two of you together. It doesn't happen often. It's always good to recognize families here in Carbon County. Had I known this, we could have had him hand out the.
Yeah.
Thank you. And thank you for raising such a fine grandson and family. We appreciate that. Okay.
Any further business?
Commissioners' reports? Is that what we have? Anything else?
First, we have further business. Anything? Commissioners' reports, Mr. Arner.
The only thing I want to recognize again, and sort of in my prayer about the firemen of our area. I mean, you've seen it all across the state or across the United States where people have lost homes through the devastation, and our fire companies were up to the task, and I want to commend them for that.
Last, like Monday
Yeah.
by myself.
Oh, yeah. Yeah.
Drive.
Yeah.
I mean, we're coming in and Tim Rothman was heading out to L and his blue light was on and I said, oh my God, there's fire. And my husband said, look at it, it's over there. I said, that looks like where Matthew lives.
Mm.
Because he lives back there and sure enough,
Mm.
we took a ride out and it was close and they're lucky that we did not have wind like we had went on Sunday.
Yeah.
Or there would have been some issues there with some of the houses.
And it's something, we just got over a fire. People are still burning and it is still windy yet. Like you think you would take a break for a little bit instead of starting a fire. Oh, yeah, yeah.
Either.
No,
Just like the other night, we were supposed to get severe thunderstorms
yeah,
and we had a little, I don't know about you ladies or anywhere here in Weatherly, it lasted 10 minutes and it
Mhm.
didn't do a thing and other
No.
places got hit so hard. Now over the weekend, they're calling for rain,
yeah,
but I said, you can't count on it
No.
because you just don't know.
no.
But, yeah, it was scary down here too, because we brought stuff down to, what fire company was doing for things, up there on Center Street, or not Center Street, up there.
Center Avenue, the Diligent.
Oh.
sports drink. Those poor guys in those coats and
Oh,
everything else
God.
sweating. They
No.
need those electrolytes and stuff to refresh.
Yep.
It's, I know I know our president said, did you get water? I said, no. I said, I got the more expensive things. Those sports drinks are quite expensive.
Mhm.
I know my grandson needs them because when he gets sick, it affects the muscles in his legs.
Oh, yeah. Yes, it
You know,
does.
so, but I'm sure we're gonna help them. And it's nice the way they have mutual aid,
Mhm.
you know, that different companies, only they help with other ones, but I think, I don't know if it's Freeland or something in Weatherly, so one of them was there, you know. They have water resources out there, there's different, cans and stuff.
Oh,
That was scary.
thank you. Any further?
Mr. Franco?
I just have two things. One, obviously, the fire, I can't express enough how grateful we are to all the local volunteer fire companies for being out there protecting those residents and that they were there. But for the state forestry to come in and do the job and bring 165 men and women from throughout the state of Pennsylvania here to help stop that fire, when you see what was going on, is an unbelievable task. And if you got to spend any time at which I did, at our training center and see how that operation goes and what it costs and all the moving parts and how they put out a fire with a fire was a great education for me. So I mean, I thank them all, and I thank all the residents for the patience. And I mean, I can tell you, like you had mentioned here that when we were over in the Jim Thorpe Market parking lot, there were actually people going in and buying water and Gatorade and bringing it right out to the firemen. So you can't say enough. And I will tell you this, the state was quick to tell us that there's not many counties throughout the state that do that. And we are one of the very few. So they were very grateful on that. On another note, I just want to bring up, I know last week, 2 weeks ago, and last night there was an article in the paper in reference to the nonprofits, and I thank you, Amy, for that coverage. We do have a preliminary, it's all kind of done. We're just crossing some Ts and dotting some Is. When that's finished, probably within the next 5 to 10 days, no shorter than 5, no more than 10. We will be posting that on the webpage and out there for everyone to see. We will see to it that when that posting goes up, we send a copy to both Times News and the TV 13, so you have it. I will make one note in there. You will see it kind of covers the year. You're going to specifically see, so let's not read into this further than it is, but you're going to see where the month of September is where we stop, and we didn't get into the month of October. There's a simple reason for that. It's not that we're not doing it in October. It's just when you factor October into it and all the fall foliage, it becomes a lot more that needs to be addressed. So in order, in essence of time and getting the volunteers interested and see what kind of interest there is out there, the commissioners felt that we get it to the end of September and then address the concerns along the way so that we're ready for October, so that we handle it in a timely manner, but in a manner that all our Ts are crossed and Is are dotted. So it's not that we're not doing it in October, it's just we're going through a procedure to get it there because we don't want to get all tied up on worrying about October and next thing you know, May, June, July, August, September are all gone and we're still deciding what to do in October. So I just want to make that clear. So don't read any further into it, that it's just being worked out. Am I correct, Eloise? With that, I have nothing further. That meeting adjourned. Where did we start last week? 2 weeks ago. Oh, you don't remember. See? Well, how about we'll start back with TV 13 today. Well, I think the one thing you need to do when we talk about that, let's face it, if I told you, when would you like to come and sell your nonprofits, I would pick I would pick October because that's when everybody feels it's the busiest in Jim Thorpe and fall foliage. And we just feel that nonprofits that are interested in being here, maybe they want to come up and try it for a week or so and see what all's needed. And do they have the volunteers? Do they understand what it's all? Because it's one thing to say you're going to do, it's another thing to not. Also, we would like to see which ones are truly committed. And, when you're going to be there, we want to make sure that there's things that are taken care of there. I'm not, I mean, it's like you had seen where Commissioner Nost, I will get in trouble for that. he had mentioned about the Boy Scouts, and the Boy Scouts are one group that I will tell you had been there for almost 11 years. And because of circumstances that happened last year, we want to make sure that, obviously, those groups that have been there and had been, whatever went on, we're not here to get into that, but that is specifically looked at. And that going forward, that is also taken care of. So it's not like we're holding anything, it's just that we want to make sure that where problems happen, that doesn't happen.
I don't know.
Well, we haven't had anybody call here, no, but I can tell you, as I've traveled around the county in the last 2 weeks, I've had numerous people come up and thank us for it. We're happy at least it's being offered, and, are looking forward to seeing if they can do something. So, do we have that official? Well, it's like everything, everybody's all in until it's time sometimes to sign on a dotted line. So, but at least now it's offered, and that's was our goal. That's it? Wow. Amy, you're sitting there with a big smile on. There's gotta be more. Good morning.
Mackenzie's office. So
Yes.
Now then with Pennbid, exact same amount as,
Well, there could be, well, put it this way, if one falls through, we could get it from the other one. And sometimes when you put in for different grants, there's like, I don't even know how that's working. There's a state and there's a federal grant. So we could actually probably get both of them if possible. So that's why we're doing it. And we're sort of doing that with all the bridges, like there's the multimodal, there's one that's state, and there's another one. So we put in for both of them. So you never know if you're gonna get the second one. I mean, the more money, the merrier.
Yeah, and I think too, with last year when we hired a grants coordinator, part of that was the amount of money we were missing out on for all those years, and under that advice, the commission, that it's out there, apply for it. And that's what it is, just about getting the revenue or getting that money into the county. So if one says no, the other may say yes. If they both say yes, boy, then we really got a problem, don't we? Very good problem.
program. There were 33 people on this program as of last month.
Okay.
Or not this previous prison board before.
Yes.
How many are on it now?
I don't even know, because some could have been released, or I couldn't tell you. And I'm not sure if that is correct, because I think there were 33 that sort of signed up for it. I don't know if all 33 were actually on it. Because they have to go through blood tests and everything to go through it. So I mean, I can get a hold of the warden and ask him actually how many are in the program. Yeah.
With regards to the inmates that are on it now, if they, obviously, nobody was taking the injectables before, it was all pills they chose. What happens to those inmates that are in the program and on the pill?
That is probably going to be a legal thing, but what they have, let me look at this. Right now, is it Subucade they're using? That's the pill form.
Sublocade is the injectable form of.
Oh, yeah, Suboxone.
Brain, yeah.
Suboxone is what they're taking right now. So they're on that, and if they want to stay on that, they can stay on it, but they're going to take it in the injectable. It's the same thing. In fact, for my experience with pills, there's more fillers in pills, and you can have more reaction to pills than you do to the injection. So we're not denying them actually the medication that they're on right now. If it were changed over. So that's something that we're gonna have to look into this policy, and with prime care, and put it this way, this gotta happen. I mean, we can't keep dispensing pills in the prison.
March, prison board meeting, you guys talked about, the prime care meeting to get this policy. Is this that policy that you guys? had
Yes.
talked about that?
Yeah, we're in fact, it's not. In
I
fact,
think the kind of, if you want to get the Cliff Notes version here, is we didn't have a MAT program. If we didn't get one, we were going to be sued. It's as simple as that. So in order to protect everyone involved there, we had to find a way to fund it and come up with that money. And as Commissioner Arner had alluded earlier, we did not want to go to the taxpayer and pass that cost. So we were able to use the opioid money to do that. With that, we followed, it's not like Prime Care's, this is the only county they have, and this is not like this is the only county that has a MAP program. So we used their advice and some other counties' advice as to how they rolled out their MAP program. So we took that and said, okay, maybe that's worked there in these other counties. What we're gonna do is roll it out as they had done, to protect all interest. Obviously, as it was said earlier, some things that work in other counties don't work in Carbon County. So we had the foundation, but we kind of, how do you build up from there? So then what we did is, as it began to roll out, we saw problems that we experienced in Carbon County that not necessarily were experienced in other counties. I think if you go way back to when we got a Vivitrol grant, if you took that completely out of the equation, I don't know if we'd ever even had this conversation. It was because Vivitrol money was available that became in. And that was because the commissioners and everyone looking forward were looking like, well, if we have a MAP program and we're providing it, where are we going to get the money to pay for the drug to provide? And that's where Vivitrol came in. Then when opioid and that all happened, when it was, okay, well, wait a minute, now the Vivitrol grant isn't as prevalent as now that we have a different way of doing this. So that's why there's been a step back in that. Now you can say, well, what happens to Vivitrol grant? Well, as we explained to you, it'll be used where needed in that. But there were issues, and Commissioner Honor had alluded to it earlier, of cheeking and people just, and signing up for a drug, but it's the old thing, you have to offer it. And if you don't offer it, well, then you get a problem. And then if there's a screening process you go through to get in there, and we were getting a run, so hopefully this eliminates a lot of that. Is it a work in progress? Absolutely. Because I consider and tell you that Carbon County is completely different than other six-class counties in our immediate area that I find unique. And that could be because we're surrounded by a lot of third and fourth class counties. So we're not like that sixth-class county with everybody on the same, and we don't, it's just, it's a process.
There are some changes you're gonna wanna make with this policy. So how quick will this go into effect then?
I would like it,
Yeah,
like, when
that's-
we send the letter,
Yeah,
at, what time is it? 11:30? It's gonna come into effect.
yeah. I mean, the
You know.
turnaround here would be days, but we have outside vendors
Yeah,
that we have
yeah,
to
it's,
work
but,
with. So
but
it's,
it's, and I said, this started off probably Carbon Monroe Drug and Alcohol brought this to our attention probably 2-3 years ago. And the injectables was the way to go, just because of that cheeking. And like I said, you could release somebody from prison and they get medication for 30 days. They walk out the door, pick their prescription up, sell it to the neighbor, and they never take it. So they come back into prison. So if they have something that's an injectable that lasts for 30 to 40, well, it's actually 45 days, it stays in their system. But we can get them on the road to recovery. And what I would like to do is give them a shot, say like 35 days before their release. And then give them 1-2 days before their release. And then try to get a provider after that, that once, we could give opiate money to a provider that would be under Exhibit E, that we could do that. And then the people got their 3 shots. And the FDA and all says that 3 shots work. It's on the road to recovery. And it's something that like alters your brain. It takes it away from it. It's almost like I said, these shots that everybody's looking for diet. It takes your takes your hunger away. Well, it takes their hunger away for taking drugs. And that's been the most successful thing. And like I said, if people are coming back in and we're going to keep them on the same program, I think that would be dumb. It's not working. Then give them the injectable and get them on the road. I said, we want people to have a successful life. I mean, I seen too many people. I said, I probably know 10 people that died of overdoses. And I said, I always come back to that one where that kid, I took him to his first baseball game and it was terrible to go to his viewing that he still had the baseball at 19 years old that he got when he was 5 years old when I took him to a professional baseball game. That's bad, and this is coming to every family. And I think people are more open to it, that it's affecting everybody's family. And I tell you what, if you don't see it in your family, then you're not looking. Somewhere along the line it is, whether it's alcohol addiction or, whatever. But we got to help these people. I mean, we can't keep incarcerating people. And like I said, I go up there in the prison and you see these people that are in, and why are you? I mean, I knew people up there that were concrete finishers that were probably the best concrete finisher I ever saw in my life. And alcohol and drugs took over their life. I mean, they could have been millionaires. And it's like, it's just, and I just have a passion for it. Like, let's stop it. I mean, like I said, I have too many. And like I said, kids on my baseball team, even some of the employees here that are in sheriff's department, their kids were on our baseball team or wrestling. Parents went to go get them and they passed away. They never woke again. So I know too many people, and I'm sure that everybody knows your neighbor. I mean, even the kid that's next door to you, that you talk to him every day and maybe he's outside throwing baseball, that might be the next one. And let's stop that.
Yeah, and the difficulty here is that this is the intersection of law and medicine.
Yeah.
And the medical professionals don't necessarily have the expertise with the law and law enforcement. And likewise, I couldn't single-handedly develop a policy because I don't have the knowledge and experience with medicine. So it's going to take some back and forth here, but if you took the prison out of the equation, then it would be simple. It's just rely on the medical professionals. But we have, when with an MAT program in the jail, you just have these special considerations because pills are currency in a jail,
No, that's.
for
money
better or
anywhere.
worse. And yeah, so
And we do have
Yeah.
2 other counties that have a policy that we're looking at that looks like it's pretty good. So we
Yeah.
might mimic off of theirs.
yeah, so will it be days? Probably not. Probably
Yeah.
weeks until we get this locked down, but I'm confident that we will.
Anything further? Yes.
One more. That, use money for this?
Yes. I'm not positive what it costs, but a shot would be around $1,000 a shot. Okay, now that lasts for a month, but I think I asked what the pills cost and I never got a quote on what the pills cost. And, and I said, the pills are just a problem. The shot works. Per month, per person, per month would be like $1,000 for the shot. No, it's just, well, and that's.
Well, you do, there, okay.
And
There is a contract with Prime Care to provide an MAT program at the prison. That's one part of the equation. And then obviously, part of that comes into how you pay for the drug. So Commissioner Arner is correct on opioid money is used for that, but the opioid money has also been used to pay Prime Care to provide the service.
I don't know. It would be the wage. Well, I said, if you have a nurse that gives 30 shots to me, they should be able to do that in 2 hours. Right now, I just talked about the guards are there for 10 hours. That means we have to have a nurse there for 10 hours. What are we paying the nurse? 10 hours a day, 30 days a month versus 1 day for 2 hours. It has to be a saving. And when you look at all these stats, everybody has stats and they want data, everything's data driven. And nobody ever gives the other side of what it actually costs currently now. They'll say, but okay, well, give me a comparison. What is one nurse for 2 hours cost versus
And-
one nurse for 30 days for 10 hours a day?
And then I think to bridge off of that, I think you need to understand, I mean, those numbers, obviously, we could get them to you, but I don't want to give a number here because it goes in the paper and all of a sudden I'm right or wrong. And I'll miss, I know it. But what you need, yeah, Eloise is over there, yeah, she will. But you gotta understand there's Prime Care, that's part of that MAP program, and then you have Carbon Monroe Pike that also is part of that, provides a service. So it's not like you just get up in the morning and say, I'm gonna go down and get on the MAT program. There's a screening process and all that has to be done on one side. And then there's the medical advice and it's sort of legal and medical cross passes. But so it's not just like you say, well, this is the one, if you wanted to, like you say, well, what does one person on this cost you? We could do a breakdown on that, but I don't want to give you that number without doing a really good breakdown because that could vary. Because some people make the program because CMP does their side and says, okay, they're in it, and other times they deny them because there's no need for them to be in the program.
And it has to have a collaboration between everybody, from when the time they get sentenced, if they go out, if they're with adult probation, CMP is gonna be the provider for the service. So it's not just the injection within the prison. You know, it involves so many things. And, I just feel it's gonna be cost effective all the way around. I mean, just look at how our court costs have gone up in the last couple of years.
Anything else? With that, I tell you all, enjoy your weekend. Have a great and safe one. It's supposed to be a nice weekend, I think, from what I'm hearing. Rainy. Really? I thought it was supposed to be, okay, well, I'll take the rain. Everyone stay in the house, watch the Kentucky Derby.